Trisha Potter with Kirkland Solutions. I just want to go ahead and welcome everybody that we have joining as a panelist today. From the STS team, we have Carol Crone. She is the director of the STS National Databases. We have Leanne Jones, who is the STS National Database Manager for both the congenital and general thoracic surgery databases. We have Emily Conrad, who is the Patient Safety Manager. And then from my team at Kirkland Solutions, today on the call, we have Maceo Cleget, who is a Clinical Data Analyst. We have John Pennington, the Director of Data Management, and we have Jeannie Ann Love, our Project Manager. And then we have two additional panelists on today's calls. They are both members of our Intermacs PDMacs core group. We have Neelam Tejpal and Rebecca Harrop. So that's who we have on the call today. Thank you everybody for joining. Today's webinar is going to be geared towards new data managers. We've broken this webinar up into two parts. So today will be part one, which is pretty much what do I need to know in order to get started to be ready to enter a patient into Intermacs? Our part two, which will be on our April webinar, will be kind of the meat and potatoes of entering a patient. So we'll be entering a patient, completing the forms. What do I need to know about entering adverse events? So this will be part one. So we'll go ahead and get started here. Today's learning objectives, the main learning objectives are that at the completion of this webinar, you'll be able to identify educational resources, understand how to contact us for support, and identify the resources for the quarterly reports. We're going to talk about the STS website, the Kirkland Solutions website, the mentorship program, AQO, the STS newsletter, and touch a little bit on reports. We do have a separate quarterly webinar that is dedicated to reporting. So I would encourage you to join those webinars. Those are hosted by Ryan Cantor at Kirkland Solutions. He goes through all things you need to know about reports, and he is available for question and answer on all of those reporting webinars. So we do those quarterly. The next one will be, I believe it's April 18th, and those are really good, but we will go over a little bit about reports today. Okay, so to get started, I'm going to just talk a little bit about the resources that are available to you on the STS website. You'll go to sts.org and you'll see tabs at the top of the page for the database, and you will click on For Data Managers. And that will bring you to, if you click on Research and Data and click on For Data Managers, you'll be brought to this screen here. When you click into this page, you'll see a button that says Access the Database. That's actually not where you'll go to log into Intermacs. This is something that's for the adult cardiac surgery database. This is not for Intermacs, but I will show you where to go to access Intermacs. So you'll click into this page. And once you scroll down, you'll see a table of contents on the left. On this page, you can ask a clinical question, find information on AQO, the mentorship program, the newsletter, and our monthly webinars. You'll first see information on advances in quality and outcomes, a data managers meeting. This is our annual meeting. This year, it will be September 11th to the 13th. So the dates on the page right now are for 2023, but for this year, it's going to be September 11th to the 13th. This will be in person this year. We were in person 2 years ago, virtual last year, and this year we'll be in person in Nashville. The Intermacs sessions will take place on September 11th. Registration's not open yet for 2024. AQO is a really great educational opportunity. It's packed full with great information. We have Q&A after each session. It's a great networking opportunity, especially when we are in person. And then after the conference, we have a hot topics webinar. Sometimes we get questions at APO that we can't answer, so we'll take it back, talk about them internally, and then at the hot topics webinar, we can get back to you with those answers and discuss it. We've done that for, I think, the past 2 years, and it's been really well received. So this is where you would come to get information about registration, pricing, the agendas, all things AQO. All right, and then next you'll see information on the Data Manager Mentorship Program, which we're now calling the Peer-to-Peer Program. The goal of this program is to pair experienced data managers with those that are less experienced. You can apply to be a mentor or a mentee just by clicking on mentor or mentee on this page. If you have any questions, you can contact Addie Dolan. I know we could really use some mentors, so if you're on the call and you have some experience, there are some mentees that would like your guidance. So those are the first two things on this page. And then next, if you scroll down, there's information on the newsletter. This is a bi-monthly newsletter that provides updates about the STS National Database. There's a separate issue for each of the 4 registries. So there's one for adult cardiac, one for congenital, one for general thoracic, and one for Intermacs. So if you would like to receive this via email, you can click to fill out the form and you'll be added to the mailing list. So that's really nice to know, what's new with Intermacs, and it's a really great thing to have. Carol does the newsletters. And then if you scroll down a little bit further down the page, there is an area where you can ask a clinical question. If you're struggling as you're entering data and you have a question, you can submit your question here. If you would like to submit a request, which is asking, if you would like to submit a request, which is asking a question, you'll click this button. You'll complete the form with your information and you will select the database for your question. So you'll select Intermacs or PDMacs. I just want to point out that in the sequence number box, you can just put the title of the question because the sequence number doesn't really apply to Intermacs and PDMacs. So you could just put the title of your question. It does need to be in letters or numbers in this field, no symbols. And then if you scroll down to complete the form, there's a field to ask your question. And just a reminder, please don't include any PHI with your question. And then you just hit submit. The questions go to Carol. And then either Carol or myself will respond within 30 days, but we will likely get back to you within a week, unless we need to review the question internally or consult one of the surgeons. If you haven't heard back from us and it's been more than a week, feel free to reach out and we can look into it. Maybe we didn't get it. So feel free to reach out if it's been a little bit. And this is the form that you will complete. You'll select your database version, and then in the sequence, you can just put the title of your question. And then as you scroll down a little bit further, the next thing you'll see is contact and support. This is separate from the clinical FAQs that we just talked about. This is for the STS National Database help desk. This would be for like non-clinical questions, questions possibly regarding billing or invoices. Those would be non-clinical questions in the contact and support. And then the next section is the essential forms and resources. Not all of these links apply to Intermacs, so I've starred those that do. The first is the database participant role descriptions, which this explains the roles of a physician representative, which was formerly known as the principal investigator, a site admin, contract contact. So all of those descriptions can be found in that link. And then the next form or the next link that does apply is the participant contact form. This is the form you'll complete if you needed to add another data manager or you needed to change the site administrator at your site. You would complete this participant contact form. It's sent to STS, and we will update that in our administrative system. And then the last starred link that does apply to Intermacs is regarding the STS National Database Audit. So I'll briefly talk a little bit about the audit process. Oops. All right, so this is where you'll come for information on the audit. I really hope none of you new data managers will receive notifications that you are being audited. But if you do get the letter from STS, you'll come here, log in, and you'll get all the information you need on the audit. The letter is sent to both the physician representative and the site admin. Once you click on that link and log in, you'll see specific instructions for Intermacs and PDMacs. You'll receive instructions with case information, data variables from our audit company, which is Healthcare Management Solutions. STS should be getting those notification letters out in mid-spring, I believe. If you have any specific audit-related questions, you can contact Emily Conrad, and you can see her email address is here. It's econrad@sts.org. So our upcoming audit, we do them once a year. Our next audit, the notification letters will be coming out in the spring. And when you receive those letters, all the information that you need to know and what to do is included in there. And then these are the variables that are being audited this year. You can see that we pull a couple of variables from each of the forms. So we have a question from the demographics form. We have information from or a couple of variables from the pre-implant form, the implant discharge form, our rehospitalization form, adverse events forms, looking at all of them: infections, bleeding, neuro, hepatic, renal dysfunction, respiratory failure, and device malfunction. A couple of variables from the 3-month follow-up, and then information, a death date from the death form. So we do look at all the different forms, a couple of variables on each. Emily, did you have anything that I left out from the audit that would be helpful for somebody new?
I think, yeah, that was all really good. And yeah, the information will be posted on the website that you can access. It'll be like the instructions that HMS puts together. And then HMS, the audit company, will also send you an email directly with all of the case information and the audited variables and instructions on how to upload that information and what they're looking for. And then this year, we're also planning to have a webinar for the people who are selected for audit. If you want to join and ask any questions to the auditors prior to the audit, we'll be hosting that as well. So just thought I'd let you know that we are offering that this year so that we can try to get as many questions answered prior to the audit period starting, so you know exactly what needs to be sent their way.
Excellent. Thank you so much, Emily. Appreciate that. Okay, so that's about the audit. And then if you scroll down to the bottom of the page, you'll see information on our webinars. You can see on here the upcoming webinars, what time they are, the dates, how to join. And then there's also information on the most recent past webinars and their slides. There's also a button that will take you to the YouTube channel that houses all the previous webinars. And like I said before, we do also have a quarterly reporting webinar. So once a quarter, Dr. Cantor, he hosts a webinar geared towards reporting, and the Intermacs and PDMacs user group webinars are usually on the last Wednesday of the month. So you'll see here, there's a link where to join, the date, the time for the upcoming webinars, and then you can also view past recordings and the respective slides as well. So that's great. So if you do happen to miss a webinar, they are recorded and you can access both the recording and the slides. Okay, so now just switching gears a little bit. So that was what I wanted to show you on the STS website. I'm going to now move over to the Kirkland Solutions website, which is intermacs.curso.net. Kirkland Solutions is the data warehouse of the Intermacs and PDMacs data. You'll see on the right-hand side of this page is where you go to log into the database. So you can log in, if you're an Intermacs user, you would log in by clicking on the Intermacs data entry login. If you're a PDMacs user, you would click on PDMacs data entry login. And we're going to go actually into the website, into adding a patient and completing the forms in our next webinar. So we will go through that whole process. But I did want to show you, this is where you go to log in to Intermacs. And then I do want to point out that while you're on that page, intermacs.curso.net, if you scroll all the way to the bottom of the page, there is a link for a data entry guide. If you click on that on the top of the page, you'll see training slides. These slides will walk you through the process of screening a patient and entering the forms. Also on this page, you'll see information on how to add a new device, like an RVAD, add an AE. And we'll go through all of that on our next webinar, but I did want to point out these training slides. It's just a PowerPoint deck, but goes through the whole process with you. So we will go through it live and have a recording of it, but there are these PowerPoint slides if you did want to reference these. And then back on that page, intermacs.curso.net, we do have a data entry FAQ. This guide has lots of tips. It hasn't really been updated in a while. We do have a more current FAQ document, which I'll show you in just a few minutes, but there are some pretty good questions in here. So on the left, we have the data entry guide, and then we do have the data entry FAQ document. Now, if you come back to the home screen, intermacs.curso.net, you'll see these tabs at the top. This tab here, the Intermacs appendices, houses mostly all of the information you'll need for your data entry. So we'll click on here. And first on this page, under Appendix A, you'll see our adverse event definitions. If you click into that, it's a Word document with all of our AEs and their definitions listed. This will be your guide to entering AEs and Intermacs. When we do part 2 of this session, we'll actually dive a little bit deeper into the AEs, but they are all defined there. Then next, under appendices F and G, these are the quality of life surveys. The quality of life surveys are collected pre-implant, 3 months, at the 3-month follow-up and 6-month follow-up, and every 6 months after that. So those are listed here, but because of copyright, we can't post the URAQUAL, which is the EQ5D, on our website. So if you need those, you can reach out to us. Oops. Oops. And then just scrolling down, there is information on stroke scales. Neurodysfunction is one of our AEs that we collect. The majority of the time, you'll find the patient's stroke scale score within the medical record. However, we do allow you to score the patient based on documentation in the chart, but those scales are here for you. And then the next section, Appendix J, is where you will come if you want to submit a minor data request. I believe there's two options for minor data requests, minor data requests for research purposes, and minor data requests for quality improvement. If you click into there, it will bring you to the STS page, which with the full process of how to submit a minor data request, as well as contact information if you have any questions on submitting that request. And then under Appendix K, you'll see our device brand list. This helps to differentiate between durable devices and temporary devices. Um, durable devices are devices with potential for patient discharge, meaning these devices are devices a patient can leave the hospital and go home with. Temporary devices are included in the database, but only when they are simultaneously implanted with a durable device or after a durable device. They don't meet the Intermacs definition of potential patient discharge. So there's a full list of our devices on there, and they differentiate between durable and temporary. Durable meaning a patient can be discharged from the hospital with it. Temporary meaning they have to stay in the hospital, and those can only be implanted when they are added into the database when they are simultaneously implanted with a durable device or after a durable device is in place. And then moving down the page under Appendix M, we have our user's guide. Within this document, you'll find all the data variables that are collected in Intermacs. There is a training video that will walk you through entering a patient. We're going to get into that on our next call of actually entering a patient, but there is a training video here. Also under, I believe, Appendix O, you'll see the profiles at the time of implant. This is where you'll find the profiles of advanced heart failure. This is something that we collect on the pre-implant form. These profiles provide general clinical description of the patients. So those are defined there. And I just wanted to mention, if there is significant clinical change between the initial decision to implant and the actual implant procedure, then the profile closest to the time of implant should be recorded on the pre-implant form. And then patients admitted electively for implant should be described by the profile just prior to admission. So those definitions are there if you need to reference them, as that's a variable we collect on the pre-implant form. And then under Appendix P, you'll see all of our forms. I want to point out that the 1 week and the 1 month forms are the same. And then the 3-month form will have some additional data that is not captured on the 1 week and the 1 month. The 3-month form is a little bit more lengthy. The 3-month form is the form you'll see every 6 months moving forward on follow-up. And we complete forms 1 week, 1 month, 3 months, 6 months, and then every 6 months after that. Based on the implant date. So it's on the 6-month anniversary of the implant. Under the list of forms, there's also some helpful resources. There is an FAQ document that is updated quarterly, as well as some major infections slides. Major infections are one of the AEs that we collect, and we get a lot of questions on those, as we have questions about multiple organism infections, pre-implant infections, chronic infections, those chronic driveline infections you'll see in your patients. So we do have some helper major infection slides to kind of help with entering that data. So that is there. And the FAQ user's guide, like I said, that's updated quarterly. So I will be updating that towards the end of this month, early April. And I try to include in there any questions that I kind of see as a pattern coming in, that maybe our questions aren't very clear and there's a little bit of gray area. So I try to include those frequently asked questions in there. And as you're sending in your question, if you think that this is something that should be certainly included, feel free to include that in your email, and I'll be sure to include it, because if you have that question, likely somebody else does too. And then just finally, at the bottom of this page is Appendix S. And I just wanted to point out that we recently updated how we handle RVADs. In the past, when an RVAD became ECMO, meaning it had an oxygenator attached, we asked that you complete the explant form to remove the device from the registry. This is no longer the practice. The RVAD now stays until it is removed for good. So here under Appendix S is where you can find the slide deck titled RVAD Changes that speaks directly to this change. So just, I want you to know, moving forward, if you have a patient that has an RVAD in place and it then begins to function as ECMO, you don't need to remove it from the registry. You can leave it and then explant it for good when it is turned off and taken out. Okay, we're now returning to the Kirkland Solutions homepage, which again is intermacs.curso.net. Next to the Intermacs Appendices tab, you'll see the Reports tab. Here's where we house the information you need to know about the reports you receive. Each quarter, Intermacs provides site-specific information to the site administrators. This includes the quality assurance report and the data quality report. The data quality report provides you a snapshot of key data that you've entered into Intermacs, and it also includes a list of inconsistent and improbable data values. The quality assurance report contains information from your site compared to Intermacs overall. So on this page titled Quarterly Site Reports, you'll see examples of reports as well as the report distribution schedule, which I'll show you here. This is our report distribution schedule that shows you for each quarter the data entry deadline, the coverage stop date, and the distribution date. So you can see here, you will be receiving the Q4 report here at the end of the month for Q4 2023 on March 31st. So breaks it up by calendar quarter, data entry deadline, coverage stop date, and distribution date. And then I want to point out the research SAS data sets are distributed quarterly and link all forms into 4 data sets and can be used for analysis of your data. This feature is only available to the site administrators. The live data downloads. The live data downloads allow for instantaneous download of data by form entered into Intermacs in a variety of formats, including Excel. So all data, all live data, as it's entered into the database. You can go here to live data form downloads, and you can access all of your raw data. There is instructions and a tutorial available on this page if you click into there. From reports, if you click into live data form downloads, there is a tutorial and instructions to walk you through how to download the forms. This is where you can access the reports FAQ page, where you can find general questions and answers about who can obtain the quarterly statistical reports, where can I find quarterly statistical reports, and how do I download them? How are duplicate entries handled? Data entry mistakes, how do we remove those? Those kind of questions. And then we also have outcomes analytics tool that can be used for internal quality improvement. There is a presentation on this page that will walk you through how to utilize that tool. And then PDMacs. So just like the Intermacs appendices, if you go to the tab at the top for PDMacs, there are PDMacs appendices. So similarly to Intermacs, you can find AE definitions, quality of life surveys, the user's guide, and all of the data collection forms. So that's kind of going through the resources available on the STS website, and then moving over to the Kirkland Solutions website, the resources that are available to you there. And then we will have a part 2 on April 24th, 2024 at 1 p.m. Central, which will take you through entering a patient, completing the forms, entering AEs, and we're talking about maybe doing some polling questions. So that's kind of what I have for now. I allowed for some time for some questions and answers. If you have any questions, please put them in the Q&A box. We will answer your questions, and if we can't get to it, I will definitely get back to you with an answer. So let's see here. All right, so it looks like we have one question from Sarah. Is this question asking if the patient has been intubated since implant or just since last follow-up? Was the patient intubated since implant? This includes all time since last follow-up. So yeah, so Sarah, that question, so if you're completing that on a follow-up form, it's asking if the patient has been intubated since last follow-up. And that does not include intubations for procedures, only for respiratory failure. And then Tiana, the webinar will be in Central Time, so it's 1 p.m. Central. What other questions do you all have? Not exactly a question, but can we continue to get generic error messages on Intermacs frequently? Thank you for letting us know that, and it's really helpful if you all can email me if you do receive a generic error message. I can get that over to the programming, the development team, Rama's team, and let them know, and they can look into it. So I apologize for that. If you do encounter it, feel free to send me an email and we'll take a look into it. And then I just want to share my contact information. My email address is patricia.potter@curso.net. If after this webinar, if you think of something that you have a question about, or as you get to entering data and you have a question, you're always welcome to email me directly, or you can go through the process of submitting a clinical question. Either way is fine with me. But that's how you can get in touch with me. What other questions do we have? Emily, it looks like Cyrus raised their hand. Do you want me to, are we able to take them off of mute, or was that maybe an error?
Looks like they put their hand down.
Okay. Maybe hit it by, okay, got it.
Oh, I said sorry. No
Okay.
problem.
All right. Hi, Spencer. Is there a way to avoid entering the entire implant cascade when adding an RVAD during the initial implant entry? Well, if it's during the initial implant, it would be a BIVAD, meaning RVAD and LVAD during the same OR visit. So it should only be one implant form. But if you're asking, oh, I see, when not done in the same OR visit. No, that's kind of the process. We're looking to collect the data on the patient at the time that they needed the RVAD. So I know it's a little bit time consuming, but we do want to get that data. I noticed on the FAQ, it says you no longer need to directly enter these AEs. The information entered at each follow-up visit is used internally in regards to hemolysis. Oh, are you looking at the on the Kirkland Solutions page, that data entry guide on those slides? Those specifically, that text applies to PDMacs, not to Intermacs. Intermacs, you do have to manually enter hemolysis, right heart failure, and hypertension events. Did you mention that the 3-month follow-up form will be replacing the 6-month? No, they're the exact same form. So the 3-month form becomes the 6-month form. Oh gosh, in this recent case, it was 4 hours. It was within 4 hours of LVAD implant. I'm sorry. Because it could have been a BIVAD, but yeah, it would be a separate entry with a separate pre-implant and implant form for the RVAD. Stacy, do you prefer us to use STS FAQ clinical question form, or is it okay to email you directly? We're trying to kind of do a little bit of a practice change where the questions do go through the STS FAQ clinical question form. That way we can have a log of them. STS can see them as well as myself. And then that way the questions are well organized and we can have a log of them. And any questions that maybe need to go to the core group or go to the surgeons, it allows for that. But you are welcome to always email me directly, but we are trying to have you go through the STS FAQ clinical question form just so we can get a good idea of what the questions are. If data is entered for follow-ups past the grace period, be reflected in the later reports. Not past the grace period, but past the coverage, the data entry stop date. John, did I answer that right? So if you're entering data outside the grace period, that's okay. It should still be entered. It should still be in the reports, but the reports are based off of the data entry deadline. Did I answer that right, John?
Well, I mean, it's kind of a nuanced answer. So as far as reporting, there's also like a few versions of those reports where there's like a cumulative report and then a more recent report. Um, but to my knowledge, no, it doesn't matter. I mean, that's kind of a Maceo Ryan question. But once they get that form entered, yeah, it may have been entered past the deadline. But as long as it falls in the reporting window, it'll be included in what's in those exhibits.
Said that right. Yeah. Yep. Thank you. And then Carol, it would be nice if you could remove 3 from the 3-month form since we use it going forward. Yeah, that's a good suggestion. We could probably look at labeling it as something else. But yeah, Carol, it's the same form moving forward. Did I miss a question here? Oops. All right, Linda, patient came out of the OR from LVAD implant as well as VP ECMO. The patient was decannulated from ECMO 5 days later. Do I need to complete an explant for the VP ECMO? No, you would just include it that ECMO was cannulated on the implant form. Well, Linda, was the RVAD left in place or was it just ECMO? I guess that would be my follow-up question to that question, because if it was ECMO and then became an RVAD and the RVAD stayed in place, then it would need to be added into the database and then explanted when it was complete. But I'm thinking it's just ECMO in this case. So no, there's no explant form for that. Yeah, no, you don't need to explant that. Just indicate that there was ECMO cannulated on the implant form. If a patient has a history of cardiac arrest and there is no documentation of VFib in the patient record, can we select VFib for arrhythmia for patient history? No, not if there's not documentation that the patient had VFib. I would not include that. Any other questions?
Really great job, Patricia. Good job. It was a nice presentation.
Yeah, this was a great call, Patricia.
Yeah, thank you.
I appreciate it. So we will have a part 2, and I hope you all come back for that session. It'll be in April, April 24th, and we will go through actually screening a patient, completing the screening log, entering the patient, and then kind of give you some tips and tricks on entering AEs and how to keep track of AEs, and hopefully there'll be a lot of really good applicable information for entering your patients and monitoring the follow-up of them. Any other questions? We still have some time here.
Looks like everybody enjoyed it. Thanks, Patricia.
Great job, Patricia. You did awesome.
Thank you, Neelam. Okay, well, I guess, Carol, do you want to call it a webinar?
Let's call it a webinar. Emily, you good with calling it a webinar?
All right. Great job.
Great
Have a
job,
good one,
guys.
everyone.
Great job.
Look
Yeah,
forward
thanks.
to this,
Thanks, Neelam.
part 2. All right.
Thanks,
No worries.
everyone. Thanks,
Y'all
Rebecca.
have a great
Thanks,
rest of your
John.
week.
Thanks, Maceo. All right,
Thank
take
you,
care.
guys.
Thanks,
Bye,
everybody. Good
April.
job, Patricia. Bye.
Great job, Patricia.
Bye,
Bye-bye.
everybody.